Good question. So when I see a patient who's coming to my clinic for evaluation for possible treatment for hepatitis C, there are a couple of things running through my mind. So first, it may be important to confirm that they have chronic infection. Sometimes I'll see patients who have been screened with the antibody test, and so they have the antibody to hepatitis C virus, but there's no documentation that they have had nucleic acid testing, which is needed to confirm diagnosis. So first I'll test to do the HCV RNA test to confirm that they have chronic infection. The next step is a lot of counseling and education to the patient, providing them information about how they may have acquired hepatitis C, what's the natural history of the disease, what to anticipate in terms of future health consequences, and then moving into talking about possible treatment options, which there are many of now, and that certainly is different than just a few years ago. So then, in terms of deciding what treatment options to provide a patient, there's some workup that we need to do to get a sense of what type of virus they have and the extent of liver damage they've had. So oftentimes this will require some additional blood work to determine the genotype, to see if they have evidence of inflammation in their liver, and then also some imaging modalities are often used to get a sense of whether the liver has sustained pretty significant damage over time, or the extent of damage that the liver has had, because that'll influence treatment decisions. And then just some additional history from the patient in terms of whether they've been previously treated for hepatitis C, because that also influences the treatment decisions. So sometimes it's very helpful when healthcare providers who are planning to refer a patient to me are able to do some of that initial workup, which is to confirm the diagnosis of hepatitis C, look for liver function tests, coagulation parameters to get a sense of the liver synthetic function, and then could start the process for an ultrasound of the abdomen to screen for cirrhosis or hepatocellular carcinoma. Then we take all of this information and we take all of this information and I present it to the patient, and we have a long discussion sort of going through what are the possible treatment options, the anticipated duration of treatment, whether they're ready to commit to the process now, and then we get started.